Welcome to the Deep Dive. Today, we're taking a look at something really quite important for your health. Diabetes blood tests. We're basing our discussion on a guide from the Blood Tests UK website. It's their article called Diabetes Blood Test in Abingdon-on-Thames, your local guide.
That's right. And what we want to do is, give you the key takeaways, what these tests actually are, why they're so beneficial, and importantly, how easy it can be to get them done locally, like right there in Abingdon-on-Thames, for instance.
Okay, so let's unpack that. A diabetes blood test. It sounds straightforward, but what is it checking? Essentially, it checks your blood sugar levels, right? To see if you might have diabetes or even prediabetes.
Exactly. It's about monitoring those levels. And there are a few common ways to do it. The source mentions the fasting blood glucose test. That's after you haven't eaten overnight.
Right, like a snapshot in time.
Yeah. And then there's the Haemoglobin A1c Test, often just called A1c. This one's different. It gives you an average picture over, say, 2 or 3 months. Much broader view.
Okay, so different tests for different insights. And the guide really stresses why doing this regularly is so key. What's the big deal about catching it early?
Well, that's where it gets really powerful. It's almost like having a superpower for your health. Spotting diabetes early, or even pre-diabetes, means you can act fast. You can genuinely help stop really serious problems down the line. We're talking things like heart disease, kidney damage, serious stuff.
Right, preventing the big complications. That makes sense.
And it's not just about prevention. Regular testing helps you understand your body better. It empowers you, to make smarter choices about food, about activity levels.
Yeah, and it helps with doctor's visits too, I imagine. Like you have actual data to talk about.
Absolutely. It facilitates a much better conversation with your doctor. It's all geared towards keeping you healthy, keeping you in control.
So that brings us to the local aspect. Knowing this is important is one thing, but actually getting tested is another. The guide uses Abingdon-on-Thames as an example. What options do people have there?
And this is where it gets interesting, seeing how accessible things are becoming. Of course, you have the standard routes, your GP, or maybe a local hospital like Abingdon Hospital, which the guide mentions.
Right, the usual suspects.
But there's more now. For maybe faster access or more flexibility, there are private options. Places like the Abingdon Clinic or Oxford Private Hospitals are mentioned.
Faster, more flexible. Okay. But what about real convenience? The article mentions something else too.
It does, and this is quite innovative mobile testing units. Think about that. They can come right into neighborhoods.
Wow, that really lowers the barrier, doesn't it? Especially for people who find it hard to travel.
Exactly. A huge help for accessibility.
Yeah.
And it doesn't stop there. Even local pharmacies are getting involved. The guide points to Boots and Superdrug in Abingdon. Apparently, they offer quick blood glucose checks, often without needing an appointment.
Just walk in. That's pretty amazing.
It really is. It just shows how these vital services are becoming much more, woven into the community fabric.
Yeah.
Easier to reach for everyone.
That accessibility sounds fantastic. But is there a potential downside? Like, if you get a quick check at a pharmacy and the result is a bit concerning, does that always connect back properly to ongoing care with your GP?
That's a really important point to consider. Convenience is great, but it's usually the first step. The source implicitly suggests this, I think. These accessible tests are fantastic starting points, or for routine monitoring. But if a result is concerning, it's absolutely crucial, and this is key for you listening, to follow up with your primary care doctor.
Okay. So the pharmacy test doesn't replace the doctor, it complements them.
Precisely. Your GP provides the context, maybe orders more tests, and fits it into your overall health picture, your long-term plan. The goal is always to empower you, to give you the information needed for that informed discussion with your doctor.
Right. So let's bring it all together. What's the main takeaway for you listening? It seems like regular diabetes blood testing is a really powerful tool. Understanding the different tests, knowing you've got local options, like those in Abingdon. It's all about managing your health proactively.
Absolutely. It's about gaining those early insights, making informed choices, and remembering that early detection, as we said, can prevent really serious health issues down the road. That highlights the incredible value of just making regular testing part of your normal health routine.
So knowing how accessible and insightful these tests can be, what's one small proactive step you might take this week to keep a watchful eye on your own health?